Hello, everyone. Welcome back to What's New and Coming Up with Lipedema. My name is Siobhan, and I'm the research specialist with Lipedema Simplified. And I'm here with Catherine. I actually gestured the right way this time, I'm pretty sure. Catherine, how are you doing?
I'm good. I am having a great day. Um, um, Leslie and I just did a video for inviting people to our June, which we'll do here. We're going to invite people here to our Lipedema Awareness Month, which starts tomorrow. Starts right now. Why not? It's May 30th. It's close enough to June 1st.
Yes, so starting Sunday, which is June 1st, for those of you who don't know, it will be Lipedema Awareness Month. So every year we try to do something focused on this that can just help raise some of that awareness, encourage other people to raise awareness in their own local communities, and really to further reinforce the community that we already have because it is so useful for people. And speaking of that, if you are watching right now, please do put in the chat a hi, a hello, a how you doing, and we will say hi back. And Jenny put in the chat, hi, Catherine and Siobhan. Hello. Hi back.
Jenny's in the Isle of Wight in the UK.
Ah, yes, I do remember.
I know there are others there.
Mm-hmm. Yeah, I think I've seen at least one other person who said that they're from there.
Um, yeah. Well, no, there are others. Tweety Bird is from Arkansas, and she says hi.
Hello back. Yeah, so what
Well,
we'll be doing through June for people who don't know is what you just did today. So what did you do? Who did
okay.
you do it with?
Yep. Let me repeat it. I am going to share screen. Share screen. Share screen. And one more time. Share screen. Okay. Here I'm sharing my screen. Now I have to. Yes.
And while you're doing that, Sarah said hello, hello back. Sue said hi from York, Pennsylvania. Monica said hi from Maryland. Rhonda said hello from sunny Kansas. And Frida said hello from Frisco, Texas. Hello to you all, and thank you for joining.
So, Siobhan, are you seeing the cover of our book?
Yes.
Okay. So, we are beyond thrilled. This has been literally in the works for years. We've been working with the publisher at least for 2 years. And before that, it was a conversation that we had, and we'd come up with a couple of outlines. I have to say, what we ended up with is different from what we started with, but that's, you know, writing a book is like that. And Dr. Roxon from Stanford, less than Dr. Keith from working with us, and me are editing it. But we have over 30 authors worldwide. And so I'm going to talk at a very high level because we're going to be doing this through the month of June. We're going to be, did I say the title? Lipedema Principles and Practice of Diagnosis and Treatment. This is not your light reading. This is the research and what's been done and what's known currently about lipedema. It's really groundbreaking, and it is directed towards the clinician, though I like to think that it's also very, very good for patients. Okay, we have an introduction, which is a definition of lipedema and being able to address the challenges for the primary care or the internist or someone making a diagnosis. It's a wonderful chapter by Dr. Carmody. Um, and then we have several chapters on the genetics of lipedema. Um, you know, I want to go into something about all of the authors. We will be doing that. That's what we'll be doing throughout the entire month of June. So I have to hold back because if I start, it'll take an hour. So we'll be looking at the differential diagnosis and comorbidities because oftentimes lipedema is confused with lymphedema and obesity and different other comorbidities, thyroid issues and Ehlers-Danlos and MCAS. I mean, there are quite a number. So we go through a lot of that during in these chapters. And then imaging, looking at conventional imaging and novel imaging, which is being able to look at an approach to lipedema diagnosis through MRI. So they did a wonderful I mean, every chapter is amazing. And then conservative treatments. We are very strong proponents of conservative care. The simple truth is you need conservative care whether you have surgery or not. So either way, you need it. A number of different approaches to conservative care, from complete decongestive therapies to nutrition to different compression and movement. And one of my favorites by our very own Siobhan Huggins and Dr. Carmody, a holistic approach to diagnosis, care, and treatment. And we're in the midst of preparing one chapter as a sample, and we'll be giving this chapter away, chapter 15, the
Awesome.
holistic approach, as a sample chapter. So stick around, it'll be ready sometime in June, early June. And then surgical options by Dr. Cheyenne and Dr. Campisi, and from Italy, one from Australia, one from Italy. The role of self care and a look to the future of care for lipedema by Dr. Roxon. And finally, resources, which Leslin and I will be writing that. I say will be, we're in the midst of editing. And so that is our table of contents. And beyond that, there's almost 300 pages. We're in the midst of editing. Um, so this will be um, release. This will release. Right now, it's set for October 14th. We're hoping to get it out a little early, but the dates that you want to remember, I'm coming back now. The dates that you want to remember are September 26, 27, and 28. Because, oh, I'm looking for how to stop this share. That's our Lipedema Congress. We're having, we're going to be hosting a 3-day conference, which we do twice a year, every year. And usually the Congress in the fall, first of all, it's very interactive so that there's lots of conversations, lots of small group work, lots of opportunities to meet with the experts, have Q&A, do deep dives, do conversation. Um, well, this is even more of that because it will focus around the book and the book authors. And to say that, you know, when I was working with Leslin and I've been editing a lot together. And as I was going through everything, I said, this is what I wish I had 15 years ago. I wish I had this. This would have saved me so much craziness and looking for answers and asking questions and traveling around the world and making a documentary and writing a book. All of the things that I did to try and figure out what the hell to do. This is it. This is that book. And so now I'm going to tell you a couple of things, but you're going to have to hang out and check your email because it's all going out in email. There's another book that we're writing along with it. It's called The Handbook for Clinicians. So, this is a textbook. Once it's said and done, it's going to be over 300, between 300 and 350 pages. We don't expect anybody to sit and read it. That's not how we interact with textbooks. Textbooks are to find information very specific. We wanted something that would be quick and easy to follow, very visually oriented. So the handbook is for diagnosing and treating lipedema. Siobhan is one of the core authors. We're actually basing it on the chapter she wrote with Dr. Carmody on the holistic approach. So, oh, wonderful. I'm just looking at some of the, thank you, everybody. Yeah, Jenny says it's great that it's all coming to fruition. It's a freaking miracle.
But I will say, like, this is what being a community is. It's figuring out what other people in the community need and figuring out a way to do it. And we've done that in a variety of ways. So Emmy's Box of Hope was a community effort of an introductory thing that people needed. This book is another component of that. The conferences that we do are components of that. It's meeting the needs of the community so that, when we were in spaces of, I wish I had this, I wish I didn't have to go through things the way that I did. Well, people in the future won't have to. They'll be able to get this book, they'll be able to get the handbook, hand it to their doctor, and be like, even if you don't know anything about this, all I'm asking is for you to read this book and help me. And if you don't know, you can just say you don't know, and that's fine. I just need somebody who's on my side through this. And when you're a doctor at the same time, if you have something like that, where it's expert knowledge, it helps lead you through, it helps you build up a foundation where you're more comfortable, it means that you become excited to realize that you have patients who have lipedema because it's like, I know what to do. I know what to tell them. I know exactly where to start. And it becomes a positive thing for them.
And that's book number 2. We are trying to escalate time deadlines. In other words, we'd love for the handbook to come out the same time that the textbook comes out.
Mm-hmm.
We can't guarantee it because in publishing, they need, we're already doing a deadline for the textbook, this weekend when the textbook is not due out until October.
Mm-hmm.
And it has a May deadline. So it needs months of going through different phases in the publishing process. And then we have a third book in the hoppers, and it's called The Voice of Lipedema, The Voices of Lipedema. And it's really a deep dive into the stories, into the complexities of having a disease that's basically dismissed or has been. We now can see it's gaining recognition. And so we're celebrating all of this during June and expanding out and being able to really raise awareness because that's what we've done every year. Siobhan, do you want to say more about even the work that you did with Dr. Carmody on that chapter? Because I still think you guys did a brilliant job.
Mm-hmm. Yeah, and it was definitely a team effort because, like, I'm very much like you in that I want, like, super detailed everything, like, all at once somehow. Like, each word layering on top of each other so I can read one thing and I just have it all. And that doesn't really work when you're trying to write a chapter. And Matt helped me. He gave me the questions that I needed to figure out what this chapter needed to be. So, and part of that was just, what do physicians need? What is the core information that they have? What are the most common things that they're going to see? And which of those things do we know what to do about? So, if there's weight regulation that needs to happen, what are the most effective strategies that we have evidence for? If there's emotional dysregulation, what's the most effective things we can do? How do we recognize it? What does it look like? So all of that. And he also made a good point that a lot of the physicians who read this may only have 15 minutes. So they need to understand how to go about the process of, you need to understand that a lot of the issues you're going to come across with patients will go into these 5 buckets of the psychological, the emotional, the physical, the spiritual, all of that stuff, and the social. And then you can sort it into one of those buckets and you can move forward with that. And here are some examples of that. So, just something that they can do very quickly. So, as they're talking to a patient, what is this issue? Which category does it go into? How can I help? What are the options? Just like that. So, trying to make the physician's job as easy as possible, because, again, once they know what's going on and what they can do about it, they're happy to help. They want to be able to help. It's why they became a doctor in the first place. So, that holistic chapter is that first step towards getting doctors to where they want to be anyway in terms of lipedema. So I'm super excited for it. It did take a ton of work, but it was very fulfilling work. And I think it came out well, especially after editing.
Yeah. Yeah. And we're still in the process. I want to answer a quick question. Kelly says, "What's the cheapest but best in Europe to get 360 lipo?" She's in New Zealand, where the exchange rate is huge. I put in. You might want to contact MedPlast in Berlin.
Mm-hmm.
They presented at our last conference. They have a holistic approach that's very, very detailed and very patient centric. I don't know what their costs are, but I know they're reasonable from what I remember. I remember thinking to myself, wow, that's not bad. I would have done that. Um, except at 76, I am not interested in surgery.
Yeah, but we had them at our past event focused on
Yeah.
surgery, and they're one of the ones that goes into what we would consider the gold standard
Yes.
for people who are interested in surgery. And they're dedicated specifically to lipedema, which is very much what you want. You want someone who's familiar with the disease, how it differs from other things that they may be dealing with surgically, and what to do about it, how to specialize, and how to personalize are the big things.
Okay, that sounds great. Thank you. Um,
Yes. And I want to make sure to say hello to people in the chat. So we have Helen from London, UK. She said, "Thanks for the update. You are welcome." We have Cindy Beers, who said, "Hi, ladies. Hello from Harrisburg." And I think Cindy also popped in earlier to say that she was going to be doing yoga. Yes. So she said she's going to be excited to teach yoga for the conference. So yes, we will see you there.
and I just
Um,
put my oops. I just put my email in. Well, no, not my email because it didn't come out right. But listen, it's Catherine at lipedema-simplified.org. O-R-G. Somebody wants me to DM them. Just email me and I'll send you the info.
Perfect. Kelly said, "Hi from Montana." Hello. We will be neighbors next year. I hope you're aware. I'm moving to Montana next year. Um, and then Susan said, "Is there any news on wound care and lymphedema, lipedema, and edema?" Um, so I can actually think of something. I would have to look up his name. And I can look it up and then get back to you next week. There's actually someone in the low carb space who's talking about ketogenic diets for diabetic wound care, and he did say that he has some patients with lymphedema. And I think he has some like presentations online. So I'll get that information and then bring it back because that might be really interesting to people as an update.
Good. And Kelly says, thank you for your kindness. Yes, of course, that's why we're here. So Siobhan and I both have lipedema
Mm-hmm.
and have dealt with it. Me for many, many years, Siobhan for many years, but less many because
I'm younger.
she's younger than me, way younger than me. I'm old enough to be her great grandmother.
I don't know that that's quite true. You're younger than my grandparents.
Oh, okay. Well, that's good to know. As I feel like a great grandmother these days. So anyway, um, so we are oftentimes we'll stop in the middle of whatever we're doing and saying, God, I wish I had this when we started. My God, I wish someone had told me this. One of the authors is talking about pre-puberty
Mm,
lipedema. And I'm like, holy cow. I had lipedema pre-puberty. It went crazy during puberty, but I had when I was a kid, my parents had a photographer come and take family pictures. And I remember being devastated because the photographer did the early version of Photoshop before Photoshop was a thing and taken off an inch from both arms because I have lipedema arms. And and you could see it's like bizarre. And I must have been 8 or 9 years old, which is pre puberty. And I thought to myself, I had those arms from when I was a kid.
mm.
So, anyway, um,
Yeah, and that's the thing. I've seen a lot of people focus on very early stage lipedema, women in their teens and 20s, but then also pubertal and prepubertal, learning how to recognizing it, learning how to recognizing it, learning what questions to ask, trying to educate pediatricians on what to look for and what to do. So all of that is likely going to be popping up more and more in the future, which is good, I think. Raising awareness about how to spot this early and how to provide healthy support in children who are that young without overwhelming them, without any of the shame or self blame or anything. Just learning what kind of help that they need and how to get it to them, I think, is going to be a good thing.
yeah. And I think of, oh my God, to save so much of the angst that we've had to go through.
Mm-hmm.
Um, Now, that being said, I often have images of us having a machete going through the Amazon forest, creating a trail or a pathway where there is none.
Mm-hmm.
That's what we've done. And
Yeah.
so take advantage of it. Speaking of which, our conference, I think I said it, I'm going to say it again. Our Congress coming up is September 26, 27, 28. And stay tuned because for the month of June, we're going to do like a throwback June to one of our very early, very first rates, which is minuscule. It's enough for a few cups of coffee at Starbucks. Um,
Yeah, and Sandra said, we're all different. I was skinny until pregnancy, and my mother was the same. Absolutely. I know a lot of people who didn't notice any symptoms until pregnancy, so it can definitely vary. And that's also good for physicians and all of that to know, so that another good example of a specialist who should be aware is obstetricians. gynecologists, so that if their patients are talking about these symptoms, they recognize what they're actually talking about. So, yeah, for sure.
Great. Yeah, there's some comments in the chat about the real challenge of growing up with lipedema, and as well. And yes, there is news about insurance codes. Insurance is becoming more amenable. We work with Michelle Jacqua, who is an insurance expert and has helped numerous people with insurance briefs to get coverage for surgery. Um, New Zealand, um, I know a couple of ladies who have been advocating, but I don't know much about it. But I can put you in touch, Kellyanne. I can put you in touch with one of the women that I know that is doing some advocacy work.
Mm-hmm.
And perhaps you can connect with her. Okay, so that's everything that I see in the chat for now. Thank you. Thank you for coming. Thank you for participating. Thank you for supporting um, awareness around lipedema. You'll have many of opportunities during the month. Um, and stay tuned. Come back.
Yes, and we'll see you next time, but we'll also see you all throughout this month. And we will see you then. So stay connected, and bye bye until next time.